Hello there, you are watching BW Healthcare World. Today we will be diving deep into the health insurance sector of India, wherein we'll talk about the post pandemic transitions that have happened in the sector, the growth that the sector has seen in the recent quarters, and the what it will see in the upcoming quarters. We'll also be talking about the challenges that the sector is facing in terms of its penetration across the country. For that, we have an eminent personality of the health insurance sector for you, Dr. S Prakash, who's the Managing Director, Star Health and Allied Insurance. Thank you for joining us, Dr. Prakash. Welcome on the channel.
Thank you. Greetings to all.
Dr. Prakash, let's just dive down deep into the questions. What are the big changes you believe have occurred post-pandemic in the health insurance sector?
Post-pandemic, if you can look at hospital side, public and people-related and insurance-related. So from the hospital side, there are a lot of digital insurtech, involvement happening, and there are a lot of transformation on the hospital side. There is a lot of consciousness on guidelines and what is international practices. Okay, what does WHO says? What does ICMR advises? Those guidelines and
Right.
Diagnosing and treating with proper validation. That culture, that's a good transformation that has happened. And the hospitals have also started investing on telemedicines for their follow-up for chronic ailments. From the public side, there is a lot of awareness on health. Particularly, there is a fear on healthcare cost. Because it is not only awareness. From pandemic, they understood that for a fever, they may have to spend even few lakhs for an admission. This awareness on cost of healthcare is more brought up by this pandemic. So this has pushed people to go and buy health insurance policy with a higher sum insured. From the insurance side, naturally, there is a lot of positive transformation. The energy, enthusiasm for the insurers to work even during a pandemic, how to develop the resilience, how to offer continuity of services, and how to involve technology to deliver the same. In all these ways, insurance companies have evolved in a much, much faster pace during this pandemic. So overall, pandemic has created a lot of positive changes at the community level, at the hospital level, and at the insurance level.
Right. If we talk about the growth in the recent quarters, how has that been for the health insurance industry? And specifically, if we talk about Star Health, how has that been?
Growth is happening. Industry is growing at a compounded annual growth rate of 20.26% in the last 6 years, 7 years. With the same growth, what is supposed to be 90,000 crore expected this year, the overall gross written premium in health, this is expected to cross 4 to 4.5 lakhs by 2030, given the same growth momentum. Or a small increase given the drivers of growth, where people are living longer, per capita income is growing, there's a lot of medical advancements and medical awareness, and financial literacy is also on the rise for people. So they want to safeguard their investment, and more people are opting to have an health insurance, which can be a collateral security for their investments, be it movable or immobile. So one health insurance policy can safeguard their wealth if there is a major diagnosis in the family. So these things have evolved beautifully, and now today I can say that insurance industry is growing, and every insurers. So Star Health is also growing positively on the retail aspect, because we are a company where we focus more on retail growth. Although in health insurance there are three segments: retail, group where the employer pays for the employee, and government where the government pays for the insurance company. Whereas in retail, the individuals are paying the premium from their pocket. And retail insurance, hardly 4% of the people in India pay their premium from their pocket. So there is a lot of potential, outer potential for growth in the retail area. So retail health insurance is one area where we focus. That is the area where we have 33% of market share, and our growth in that area is steadily growing above the industry average in the last few years.
Okay. Okay. So, and you talk about the retail segment that you focus on. Star Health has one of the biggest hospital networks among health insurance. What has been the idea or the strategy in partnering with the hospitals? And how are you leading the space?
So the uniqueness of Star Health Insurance, I myself being a medical doctor, as we started, we said that we are going to be an insurance company where we want to design the policy and we also want to deliver the services. We don't want to engage a third party to transact the claim. Whereas we have designed the futures, we have networked the hospitals. It is our duty to have our own team of people who work with our technology platform with the fixed guidelines. And we offer the best of services so that no genuine customer who has an insurance policy with us goes to the hospital and has any disappointment. This is our objective. To reach that objective, we educate our medical professionals with all our policy terms. And we have a good relationship with the hospitals. We train the hospital front desk people. We tell them if our customer comes, these are the products, these are the waiting period, these are the futures with like copay or sublimit. These are the policies where there is a restriction on room rent. So if these information are given upfront to the customer, there is no disappointment at the time of discharge. There is no delay or controversy. So we are trying to organize that in such a way that it is not only we and our qualified medical professionals who are doing claims adjudication, it is also the people who are working in the hospital front office who know about the nuances, how we process a claim. Because I have a strong feeling that if I have to give an efficient service, if I have to create a happy customer, I need the help of hospitals also.
So you build that trust with the hospitals, which is very rare to see in terms of health insurance company and a hospital.
You are absolutely right. We are one company where we have a strong provider engagement. We talk to the hospitals not only for claims, we do periodic continuing medical education program. If there is a pandemic, if there is an influenza outbreak, we call them and we tell them these are the guidelines, these are the precautions, these are the do's and don'ts. If there is an unnecessary CT scan chest being done during pandemic, we call them it is not required. If a steroid is given without indication, we tell them this is what the All India Institute of Medical Science and ICMR advise. So we make them understand and we make people follow the protocols.
So you're providing the hospital services more than what you're, inclined to do, or what are your contracts kind of is given in that. So okay, that's why that's the reason,
in
right?
fact, I will tell you, it is not me. It is the duty of every health insurer not only to pay an insurance but also give a free electronic second opinion to study and assess whether the diagnosis, treatment are all in order. And if there is any controversy, he can talk to the treating team, get himself convinced. So that in a country like India, where hospitals are not much regulated, it is also the job of insurance company, in the best interest of their policyholder and customers, to verify and authenticate the right treatments are being given. So that my customer gets not only the payment for the treatment, he also gets a free electronic second opinion, and we stay with the customer and follow till he gets completely recovered from his illness.
Right. So, Dr. Prakash, the big conversation these days is the coverage of OPD services under the standard health insurance policies. How far do you think we are from getting such a policy, and what are the requirements for building such a policy?
Yes, Shyam, if you see that, health insurance has evolved. Initially, we used to pay only for reimbursement after treatment is done. Then we said we'll pay for cashless. Then we said 24 hours you have to stay in the hospital. Now we say we don't need to stay for 24 hours. If the hospital can do the procedure as a day care, we pay as day care. The next step is treating patients as outpatient. Like, For example, we have started covering mental ailment. So mental illness, most of the time are treated as outpatient. So we have to come forward and treat cover treatment under outpatient, treatment by home care services. So all these are the evolution which is happening in the insurance sector, and we have equipped ourselves with most of the policies having OPD benefits. And we wanted to tag by OPD, I mean it is not just consultation fees. Consultation fees is very small part of the outpatient treatment. Because today it is not a clinical medicine where doctors spend more time clinically evaluate, touch the patient. Now today is the era of investigation. A doctor cross consults with other specialties, and every specialist want to do an investigation before they reach a final consensus. So in this era of investigative medicine, every OPD is accompanied by some diagnostic services and some pharmacological cost in the pharmacy. So by OPD, we say that we are going to cover consultation cost, pharmacy bills, and diagnostics. All three are going to be covered in our OPD care. That is how we have come up with the OPD care. OPD cares, the risk is more number of people insured may utilize, and the incidence or the frequency may be high. We are aware of that, but we are always we want to be a forerunner. We set to create a new trend. And so far, if you see, our accomplishments are the benchmark for the rest. So we wanted to enter into this area, study the pros and cons, and create a very strong technology platform so that the OPD claims need not come for our approval. Online, automatically, they can show the card and they can get their treatment. And everything should happen without any hassle. And the doctors who are giving this OPD treatment also, we have to track the genuineness of the treatment. How many are converting unnecessarily to an inpatient, and how many are giving a very, very scientific and ethical services. And our duty is also to identify those good doctors and recognize them. Those good hospitals that practices ethics and recognize them. We are not here only to identify frauds and mistakes. It is also our duty to identify good hospitals. That is the reason why we have a progress through synergy platform, where insurance companies and hospitals, we meet, we call them, we invite them, we ask them to tell us what are the problems they encounter in our services. We want to know from them how we can better our services. At the same time, we also want to tell them what are our apprehensions, so that we can work together and make more synergy out of the huge opportunities that are available in the health insurance and healthcare space.
Right. So currently, you said that your company or the industry is in the study mode in this is, but is there a timeline that we can put, like we can expect in a year or two or some this policy to come from the industry or your company?
Yeah, you see, I can see that if you want the industry to go from tomorrow, they may be ready, but it may not sustain unless a proper study is done to see that the cover is sustainable. So it should help the public. At the same time, it should not incur a huge loss. See, the purpose of health insurance covering outpatient is, number one, it is the need for the customer. And number two, by treating a condition as outpatient, we can avoid unnecessary hospitalization.
Mm-hmm. Right.
Now, if you see my claims, a good percentage of the claims are very, very low value claims, being admitted for some fever or urinary tract infection or some backache, which may require just a support of antibiotics and some treatment, which can be done at home, which can be supervised by telemedicine services. So that is the reason why OPD we are trying to introduce. Number one, for the comfort of the policyholder. Number two, this has to essentially minimize admission for not so relevant medical problems. So we have to study these things. If we are able to achieve these two objectives without much loss, we can scale it up in a big way. We have to network a lot of consultants and specialty clinics. We have to introduce a good MIS and system there, so that we make these payment cashless, and then we'll have to move from OPD to dental care. So we have to slowly, India has to come forward and cover home care, dental treatment, and outpatient services.
Right.
So It's a
But
matter of time. This is going to be popular.
right. You also talked about mental health, and now that your company is starting to park that in the insurance. Well, in the West, we already have that. We also have maternity care in the insurance policies. We do not have that in India. Why do you think is that? I mean, the difference is there between the West and India.
See, in the West, people understand that insurance is for protection. But here, unfortunately, some people take it as an entitlement. They know that they are going to be pregnant, they want to use it, and then they take a policy. So it's only a pooled money. So I have to assess my risk based on covering normal population, not people who know that they are going to have a claim. So that is the reason why in India we are not doing. Once we have more and more people covered, today hardly 4% of the Indian population are covered under retail. If more and more people come forward, then it is a economics of scale. No,
Yeah.
it's a game of large numbers. Then insurance companies can come forward and cover all those, artificial reproduction technique or delivery expenses or physiotherapy treatment, all those things, whatever you are looking at, can be covered when more and more people come and join this pool.
So there are two aspects, right? One is that not enough penetration is there for so the balance sheets can support such a service. And second aspect is the consumers greed in some sense that they plan it so that they can use the insurance. But for a person who's for a child who has had the health insurance policy since his childhood, or let's say he or she is a girl, and then she comes of age and she wants her maternity to be covered. I mean, then I'm sure that can be parked in
That is happening. That's happening now. That's happening now. Only thing is we have a waiting period. After that, if somebody has got an insurance policy for so many years and they are pregnant, it will be covered. It all depends on the type of policy they are choosing. They have to study the policy. So pregnancy is not a overall exclusion. Pregnancy has got a waiting period.
Mm-hmm.
Beyond that waiting period, this is covered.
Okay, all right.
So every insurance company has got different policies. There are 400 plus policies in India. So the individuals who are buying this should understand and should ask for all those specific details, get themselves convinced before they buy the policy.
Sure. Sure. Another issue that the sector has been facing is insurance frauds. As per a recent Deloitte survey, 60% private insurers see rapid rise in insurance fraud. What has been your experience of that, and how do you think this should be tackled?
Yeah, you are right. Studies demonstrate increase in insurance fraud. But I want to ask you, what is a fraud? If somebody is having a fake document, a phantom report, or an impersonation, or a hospital generating all these bills without functioning, these are all big frauds. These are essentially called as frauds. But if someone is going to admit a patient in ICU, when ICU is not really required, or someone is going to keep the patient for a long time in ICU and charge more when it is not really required, when someone chooses to give a high-end antibiotic because this antibiotic gives him a better return on investment, or somebody is using a very high-end prosthetics where the trade margin is very huge. So how do I call them? Is it commercialization or fraud? Fraud has to be detected and mitigated, whereas commercialization have to be regulated.
Right.
So this is what these are. We have to categorize them. So from as a medical man in the health insurance space, and with my interaction with a lot of my colleagues in the hospitals, that's why I said that I have identified a lot of genuine people who are following ethics and who are not recognized. And there are people who are commercial. So we are trying to create a system. We are trying to build a rule engine, and our technology platform can identify those who are commercials, who are absolute frauds, and we give a scoring index for the hospitals who are participating with us. So with that, we can joyfully tell our customers, these are the hospitals in our records are doing a very ethical and a professional services, and they can be the first choice for our customers when they want to opt for an admission.
Right. So you're saying that your technology that is deployed is dealing better with insurance fraud. I mean, commercialization we can always talk about, and there is that fee for service model, which is always kind of in question. But the frauds, which the insurance frauds, they have risen post pandemic. And I mean, I've been talking to, insurance people also, and, you see these reports. Uh, is technology the way to handle it, because technology also might be the reason that these are happening.
You're sorry, you're absolutely right. Is technology the way? A big yes. But how can a technology evolve? Because most of these people who are building the platform, they do not have a basic idea of how insurance works and how frauds can happen. See, what is the difference between we building the technology platform? I need a technical expert, but the technical expert needs a lot of medical inputs, an input from the domain experts. So we have processed and paid more than 90 lakh claims in this 15 years journey.
Mm-hmm.
So we are a rich experience, and we are trying to identify what are the areas, what are the learnings. So based on the learnings, based on the losses that we have incurred, we have created a lot of rule engine, which we wanted to give like as our input to the technical experts and build a platform. So, and there are new ways of frauds happening. That continues to happen also. So we will have to be very conscious, aware, and keep our eyes and ears open and start looking beyond our specialty, beyond our domain, outside the institution, into the real type of frauds happening due to manpower, due to hospitals using different types of softwares. And hospitals doing a very very blatant fraud, and some of the frauds are very difficult to detect also. My problem is using all my expertise, how I can build a strong technology platform. And using the technology platform, how I can identify hospitals and give a very strong signal that insurance is watchful. Do not play with lives. It is not only my insurance customers. Every citizen in this country should be benefited out of the efforts that we are taking. So whatever we are trying to impose, we wanted that to be a rule. We want to be an indirect regulators of the healthcare services, and we want to create a positive revolution. At the same time, we are willing to learn. If there are mistakes, if hospitals point out, we are willing to learn from them. But end of the day, it is not me winning or hospital winning. End of the day, the patient, who is our policy holder, should get the right treatment, and he or she should have more trust and confidence in the players of the ecosystem.
Right. Right. When we talk about the overall challenges that the health insurance industry is facing at this moment, what do you think they are? One of them is obviously you mentioned the retail segment, which is only 4% kind of used. And if we talk about the private health insurance penetration, also it's also quite less. And we're only talking about the urban areas at this moment in terms of penetration. What according to you are the large challenges which face the health insurance sector?
Health insurance sector, if you ask me, globally, if there are some geopolitical issues, valuations of company go haywire. That's one challenge globally.
Yeah.
At the national level, if government wants to impose some new laws, amendments to acts, that can be a threat for us. At the regulatory level, regulator is more friendly, and they wanted to be more principle based than rule based, and they want to facilitate health insurance penetration in India. So how best we utilize the services of the regulator and allow penetration to happen? My knowledge, my expertise, my team, embedded with the support of regulator, should essentially help insurance to penetrate in a very big way. And the next threat is how to achieve standardization of cost with the hospitals, standard operating procedures. How can I limit my outgo? If I have to minimize my fraud, waste, and abuse cost, then I need not revise my pricing. I can keep a very optimal price, which can make more and more people to come forward and buy a health insurance policy. If I allow fraud, if I start paying more to hospitals, keeping my eyes closed, if I incur loss, naturally, to compensate that, I have to increase my pricing. And when I increase my pricing, penetration becomes a challenge. So I will have to look at it comprehensively, and that's how, I'm looking at threat at an individual level, at an industry level, at a national level, and at a global level.
Right, right, right. Um, how do you see the health insurance sector growing in the years to come? Where do you think the growth lies?
See, it is expected the general insurance company cross 10 lakh crore by 29 30. So, health insurance, which used to be 9% of the GA, is now around 35%. Sorry. Health insurance share in general insurance, which used to be 9% at beginning of 2000, is now around 36% and expected to reach around 40%. So with this general insurance industry growing and reaching 10 lakh, 4 lakh crore should be from health. Health is one of the most fast moving vertical within general insurance. And I'm very confident that in the years to come, with the same CAGR of 20.26 that is happening in the last 7 years, or enhanced growth due to the increased awareness, health insurance from what it is around 90,000 crore has to reach close to 4.5 to 5 lakh crore by 2030. This has to happen because every individual has felt the need for health insurance, and I'm only looking forward to contributing the best and taking a huge share out of it, out of this growth. And
Right.
every one of us should be ambitious to take this share. Only when every individual starts running, this goal is easy to reach. And the country has also got a slogan like, health for all. What we read as medical students in our 90s, health for all. Now it has become health insurance for all. And food, cloth, and shelter is graduated to food, cloth, shelter, and health insurance in India. So it is going to be a basic human right and the very fundamental need of every individual.
Right.
So with that, I foresee a very positive and prosperous growth for the industry.
When we talk about Star Health, what are your plans in the next couple of years? What are the products that we'll see coming from your end? Are there any consolidation opportunities that you are seeking in near future?
See, on the distribution, we are looking at areas where there are profitable growth, newer strategies. So we are trying to diversify our distribution model. On the products, we are the first to innovate so many new products, first of its kind for diabetes, for people with heart disease, people with cancer and all that. In the same way, we are trying to introduce something really new, which are all in the pipeline. So our product innovation, our very, very attractive pricing for our products, and our efficient claim services with a very good engagement with the hospitals, and understanding the growing requirement of hospitals and welcoming the modern treatments and advancements in medical care that are happening. Being aware of the advancements in the new field in medicine, how to include all those new areas. We have covered very recently a child born from day one. And we are the first to introduce hospice care, pain medicine, rehabilitation medicine, all these growing subspecialties we are trying to include. So we are very watchful. We wanted to innovate and we want to embed technology in every aspect because that is epicenter today. Whether it is sourcing or servicing or pricing. In all these areas, we have to use technology in a big way and we are geared up for that.
Right, right, right. Thank you so much, Dr. Prakash, for joining us here on this talk. Thank you so much for giving us time. You're an important and busy person. So yeah, thank you.
As usual, it was very interesting interacting with you. I really appreciate your questions. Thank you so much.